Hi, I'm Marcy Landsman, Senior Editor of Cancer Today, a magazine for cancer patients, survivors, and caregivers. We are published by the American Association for Cancer Research, and we are joining you here today from Philadelphia. Each quarter, we pick a book as editors that we think will be of relevance to cancer survivors or patients or even caregivers. And we pick that book so that people can discuss it in our Facebook group, and we do that to sort of increase the conversation. This summer, we have decided to pick, and we've been discussing When Breath Becomes Air, which is by Paul Kalanithi. This memoir was a New York Times bestseller, and it talks about Paul's experience as a physician and then also as a patient with stage 4 lung cancer. Paul was 36 when he was diagnosed with lung cancer. Today with us, we have Lucy Kalanithi, who is a physician and who also wrote the final chapter of When Breath Becomes Air. Lucy was married to Paul, and she and Paul decided to have a child after Paul was diagnosed with cancer. Her daughter, Katie, is 4, so she is also a mother, and she also cares passionately about talking about patients' values and trying to factor that into end-of-life decisions. I'd like to welcome you, Lucy, to our discussion.
Thanks so much for having me, and thanks for including Paul's book as part of this series.
Thank you very much. I'd like to just start with a question that I had, which was about the book in general, and I understand that you read it obviously throughout the whole process. But did anything surprise you about what he wrote, either during the beginning process or even after when maybe rereading it?
Yeah, I guess a couple of things. So besides just the fact of it being possible, it kind of came out of fortuitous couple of events. But I think one thing was I was reading the manuscript kind of in real time every day or every week as Paul was writing it. And it was a very useful tool to communicate in our marriage almost. Like it was almost like reading someone's diary, and then getting to talk about it. So that was useful. And then especially because Paul was kind of introverted. And so he was sort of like processing internally, and writing was a way for him to cope. And then I think just the utility of actually writing it, like I think when you're diagnosed with a serious illness, or even with things like aging or disability, Paul wrote about this moment of diagnosis where the future that he had imagined for himself just evaporated in this one instant. And I think that really was the feeling. I think there's the pain of facing your own mortality, but then also what a serious illness does to your identity and purpose. And I think once Paul was too sick to work as a neurosurgeon and had fortuitously transitioned into being a writer, I think having that sense of purpose and connection, and even conceiving of this legacy that might outlive him, was really helpful for coping. I think I like to quote this thing that Nietzsche said, which is, "He who has a why to live can bear almost any how." And I think that really matters, and I think about that with my patients. What's most important to them, and how can I help them sustain a sense of purpose and identity? And then I think for people who've read the book, have seen how much words and literature mattered to Paul. And he'd been an academic guy who studied philosophy and literature, but then became a doctor because he wanted to enter into practical decision making and really human personal problems. And then when he became sick, he actually became a reader and a writer again, having a way to put words on it, to step back and try to analyze what was happening, also let it feel not so overwhelming.
Okay. In the book, Paul talks about the decision to have a child, and he describes it sort of in saying that it was really that you felt it was up to him. Is that how you remember it? And can you talk a little bit about what that was like at that part?
Yeah. It was so intense because Paul was diagnosed, as you know, at stage 4, which as it stands right now is incurable. And he lived for 22 months after being diagnosed. We had a child who was 8 months old when he died. And as you said, she's now 4. It seemed a little crazy, actually, and both of us kind of knew it was crazy. And he was more certain than I was initially. And both of us knew I probably at some point would be raising her on my own. And he wrote about a conversation that was incredibly important during that decision that really crystallized things for me, where we were talking about the decision. And I said, I'm really worried about what this will mean for you. And it's inviting more uncertainty, and it's arduous to have a kid. And then, like, most of all, if you are sick and you might leave the child behind, don't you think that'll make this illness more painful or make dying more painful? And then he said, wouldn't it be great if it did? Mm-hmm. And that was like this really lovely moment that I think for me kind of, nobody has a child because it's easy, anybody. And you do it because it's meaningful and rich, and you think you could take good care of the child. And I think we both felt that like that was still possible. And it turned out to be this beautiful, rich thing. I can't imagine like not having done it. And then I read the book Far from the Tree at that time. Do you know that book by Andrew Solomon?
I've heard it. Yeah.
It's beautiful. Now there's a Netflix documentary of the same name. And it's about raising a child under some kind of arduous circumstance. In this case, like where the child is really different from the parents, like things like deafness or autism or, committing a crime or whatever. And I think I read it because I just wanted to see like what the hardships can be when you have a child. But the upshot of the story that he even surprised the writer Andrew Solomon was just how much people can cope with adversity in really surprising ways, or can come to accept a life that they never thought they would have. And so it actually turned out that that book contributed to me feeling like it was possible to cope with having a kid. So that book helped.
In the moment when you're having hold on one second, we're getting a little feedback here. In the moment when you when you were having Katie, what was that like? Paul had just recovered from his illness. He was going home from a doctor's appointment, I believe, and then came back and was there. How was that on your end in terms of just what were you thinking, I guess?
Right. It was so intense. Paul had just come out of the hospital with a pretty long 2-week hospitalization, and he was really weak. He described in the book how he had to use 2 hands to lift a glass of water because he was really weak after this hospitalization. And so my mom was my like labor partner person, but then really the person I wanted there was Paul. And so in the end of the labor, he came into the hospital with his dad and was there for Katie's birth, and it was fantastic. And I think, I don't know, it's so hard to describe. It just was like fabulous. And I think also, for him to have a new child who's growing alongside this illness, and then also just to feel this sense of purpose as a parent, like even though he was more physically debilitated, having a newborn, like I needed a lot of support too. And so he was providing support to me. And I think that's really helpful. He didn't have to feel purely like the object of help, or like he was no longer an agent or something. I think being a parent, you like become an agent pretty quickly. And then, but then for me personally, my sister is a blogger and writer who has had really severe postpartum depression 2 times and has written about it. And I was very worried about depression particularly. And so, we were really careful. Paul like really looked out for me, and I made sure I was exercising. And after Katie was born, we tried to make it so that I could sleep as much as possible and just be able to cope. I think I was nervous about that. And in particular depression, just because, necessarily you're emotionally detached and alone when you're depressed. And I was really worried that with limited time for Paul, like how would I care for him and how would I make the most of that time? But it turned out to work okay. And I think we were really lucky for that.
Yeah. So you felt supported too. You had a lot of support as well. So with family as well.
And I think for me, like the things that helped me cope, the last Surgeon General did this whole thing on emotional well-being as distinct from mental health, and promoting things like exercise, mindfulness meditation, and sleep and social connection. And it's like, it's not rocket science, but it helps to focus on those things. Paul told people around us, he said, I want everybody else to take care of Lucy so Lucy can take care of me. And it was this really helpful acknowledgement of how much, supporting the immediate family member for somebody with an illness is also a way of supporting the patient. And I was really grateful to him for kind of getting that.
Okay, looks like we have a comment or a question. Let me just take a look at it. It says, Paul wrote about asking for statistics on his prognosis from his oncologist, Emma, and about her resisting giving these. What role did statistics play for you as a doctor and a wife in understanding Paul's lung cancer? And how would you advise that patients think about statistics and prognosis?
Yeah, so this is such a good question. And I know everybody struggles with it, and we did. I guess in no particular order, I'll say my thoughts about it. So I like some of the things Paul said in his writing, one of which was something like trying to calm existential distress with statistics is like trying to quench a thirst with salty water. And that's part of it, right? Like the uncertainty, it's so overwhelming and can be its own type of pain. And I think oftentimes when people say, how long do I have left? Partly they're asking like, who am I still and what can I still have? And then, as a doctor, statistics, like if a doctor ever says you have 15 months to live, Paul described that as being more precise than you can be accurate, which is to say that usually means the median. So that usually means half of people would live less than that and half of people would live more. But it doesn't tell you of the half that live more, how much longer do they live more? And then where do you fall in that curve? I think the way I was taught to prognosticate when I was a resident physician was basically to think about a general range that you could tell people. So for most patients, we have a kind of an idea of whether they might live days to weeks or weeks to months or months to a few years or many years. And those ranges are not super specific, but I think for Paul, we both had the general sense that most people with his particular illness live months to a few years. And with new treatments, some people are living multiple years. And that's enough information to know like whether you want to try having a baby, or to know that you are hoping for the best, but you also want to put things in place in case the worst comes to pass. And so that's kind of, we can't really prognosticate very well, but I think you can have a sense and a range in many cases. And it's interesting because there's research showing that physicians are also really uncomfortable talking about it or asking and or talking about it or bringing it up. So in a way, sometimes it's on the patient's or caregiver's shoulders to ask, which I think is just important to remember, that it is okay to ask. And at the same time, it's really hard to be specific. So anyway, and then I think the cool thing about cancer and the hard thing about cancer is that prognosis is getting more difficult. So even for stage 4 cancer with novel therapies like the little group who responds really well to immunotherapy or the targeted therapies for lung cancer like Paul took, he had an EGFR mutation and is on erlotinib. Some people are living longer, and I think for subsets of cancer, it's starting to turn into a chronic disease. For most people with advanced cancer, not yet. But I think there's even more uncertainty now, and that's great and also painful.
Thank you.
I hope that answers the question. I struggle with this a lot, and it's a
yeah.
question. Yeah.
Were you surprised about the way that Paul wrote about your relationship, even going so far as to say basically that he felt cancer had saved your marriage? How do you think cancer changed your relationship? And I think you might have talked a little bit about that in the beginning, but can you elaborate a little more on that?
Yeah. So Paul, in the prologue to the book, where he's describing the time leading up to his diagnosis, talks about how, our marriage was kind of in a tough spot at the time, mostly due to kind of work-life balance. Paul was a resident working like over 80 hours a week, and I was working really hard too. And we kind of joked about it at the time. He surprised me. That actually was the thing that surprised me when I read that he was writing a little bit about it. I was like, like when you're a third grader and they teach you to write a story and they're like, start with a catchy intro. I was like, thanks a lot for like a catchy intro to your memoirs. Like this marriage difficulty for us. And now I know all about everybody else's marriage because people now tell me. But it's the truth. And I think I kind of like that he wrote about it. I think it tells you up front when you're a reader that he's going to be straightforward. And then I think the way in which it helped us, in which things shifted quickly when he was diagnosed was, I think we immediately and luckily started giving each other the benefit of the doubt. I think previously we've been like starting to resent each other a little bit, which is sort of like, that's dangerous in a relationship. And there's this relationship expert. I don't know too much of his work, but his name's John Gottman, and he runs this love lab. And he talks about how the kiss of death in a relationship is eye rolling, like serious eye rolling, like missing your partner's emotions or losing empathy for your partner or resenting your partner. And I think, like that's when you start to lose the ability to connect. And I think the diagnosis, like, it just was so shocking that I think it made us both immediately recognize the need to listen to the other person and give each other the benefit of the doubt. And that kind of never stopped after that. So that was lucky.
Okay. We talk about Paul writing the book, and I'm just curious how that worked from a scheduling thing. Paul kind of went all in, it seemed, with everything. How was that with balancing, a new baby and your marriage and dealing with all of these issues, and then writing as well? Was that how did that? Was there a tug there or a pull at any point with his time, or how did you guys manage that?
Yeah, I'm not even quite sure how to answer it. Paul went back to work as a neurosurgeon for a year and finished residency, which was really important to him and his identity, and the targeted therapy chemo pill made it possible. And then when that stopped working, he focused on writing instead. And the writing, like Katie was born around the same time that Paul really started writing in earnest. And he mostly wrote in our living room. And like, I was just kind of around on maternity leave. And Katie was there, obviously, and a bunch of family were around. And I think like a lot of people, having a newborn is a lonely time, especially if one person's home and the other one's back at work. And for us, it was such a cozy time. And the fact of writing was kind of social in our house, at least by dint of proximity, So it actually was really cozy and nice. And then like tying back into the prognosis question, this was really hard, but I think Paul sort of had a sense in his mind of how he might react and what he might prioritize depending on how his prognosis was changing. So when he first was diagnosed, there was a possibility that he might still live multiple years. And so he wanted to continue to be a neurosurgeon. And he knew that when the most effective treatment stopped working, he wanted to focus most on writing. And then as the disease progressed, he started to focus less on writing and more on spending time with family. And so he had a bit of a sense of what his top priorities would be as his time became more limited. And that, I think, was clarifying and helpful, even though it was obviously also painful.
Do you have any tips for people who are caring for people who are facing a late stage disease. Just do you have any tips for those people?
Yeah. I think my number one tip that I would almost say to anybody is to consider involving a palliative care specialist and a palliative care team. And I'll just explain what it is quickly for people who don't know. I think oftentimes people hear palliative care and they think that it means you are close to dying or you have to be dying to have that type of medical care. And actually, that's true for hospice, which is a tiny subset of palliative care. But palliative care itself is just for anybody with any serious illness, and it doesn't have to be a terminal illness. And you can get that type of care alongside your other care, like your chemo or any care that might be meant to cure you or whatever. So a lot of people who have things like Parkinson's or heart failure or different types of cancer or HIV or just whatever. And usually it's a team of a palliative care doctor who's a specialist in especially symptoms and quality of life. And then usually there's other team members like nurses, social workers, sometimes chaplains. And the specialty is focused on quality of life for the patient and the family or loved ones around them. And I actually think like if you redesigned healthcare, it might actually start with palliative care because the quality of life, no matter how much longer you have is, part of what we all are really looking for. And there's at least one study where patients with advanced lung cancer who had their oncologist and a palliative care team had better quality of life and less anxiety and actually lived longer, even though they used slightly less intensive medical treatment in their choices. So anyway, I think they really help people live as well as possible for as long as possible. And they're just they're great. So one tip is to ask for a palliative care consultation or specialist. And then there's a website called getpalliativecare.org, I think, something like that. It's the Center to Advance Palliative Care. You can find it. And then I think those kind of general coping things are really important. Like exercise and sleep. And I think a lot about family caregivers too, there's 40 million people doing that job and taking care of an adult relative. And when you're doing it, you kind of feel like you're the only person who's doing it, but actually you're not. And there's starting to be legislation and researchers, and the AARP has a lot of resources for caregivers, and Congress is looking at legislation to support caregivers better, in ways similar to maternity leave. So anyway, I think, don't forget to take care of yourself, certainly.
Yeah.
And it's not an easy thing. Although it's so gratifying, at the same time.
Yeah, it is. Yeah. We received another question, and this Facebook user says, "Hi, Lucy. Thank you for your time. Although the outcome of this book is obviously sad, the tone of the book is not. I felt like the combination of the simple but lyrical language and the medical information kept it from tipping over into being a tearjerker. Was that intentional? Was that how he was? Or was it just a matter of my perception?"
Oh, that's such a nice question. Thanks for saying that. I think it's not an accident. And that's sort of that's what Paul was like.
Oh, nice. You wrote the final chapter of Paul's book, and you were his advocate. And I recall you saying, if this isn't going to work, then we need to take off the mask and have Paul hold Katie. Can you describe what was probably the most challenging part of your role as caregiver? And you also kind of touched upon this, but the rewarding part of it too.
Mm-hmm. Are you talking about those decisions toward the end?
Yeah, those decisions. Yeah.
Yeah. obviously that was so intensely sad. I can't overstate it. Of course, everybody knows. It's funny because, you know, people talk about how death is the one commonality, and I think so is grief. You know, I think we'll all lose people that we love. It's so hard. Yeah, so I think the thing that helped us toward the end of Paul's life and that helped me be an advocate for Paul was having a clear sense of what was really important to him. And for Paul, it was being mentally lucid and being able to interact and think clearly and ideally keep writing because he was working on the book, you know, right up until a few days before he died. And so that affected his medical care decisions kind of throughout. Like as an example, his palliative care doctor put him on a stimulant medication so that he could focus better when he was writing, particularly because he had a lot of fatigue, and then he was on painkillers that had their own side effects. And then toward the end of his life, he was facing the decision about whether to go on a ventilator or breathing machine. And it became increasingly clear that he probably wouldn't be able to come off of it. And so, his goal of being mentally lucid and able to interact and write wasn't going to be possible. And so that made that decision making pretty clear. And so I think having, other people say, I'm trying to survive as long as possible so I can go to an important family event, see my child graduate or whatever.
Mhm.
Other people say the thing that's most important to me is to avoid pain or other symptoms like shortness of breath. So it's like, there's lots of priorities that people have. And I think if your family and you and your healthcare team know what they are, then there's a lot we can do in healthcare to work on those. Yeah, so I think that's the important thing. And, I think having an advance directive is really important, like the paperwork. But in a way, an advance directive is actually really simple. Like it came out, that paperwork came out of the patient autonomy movement where people, you as a patient have the right to refuse medical care that you don't agree to. And an advance directive, I think, came out of a Supreme Court decision saying that someone you designate to act on your behalf also has the right to refuse medical care for you. But that's all it does. And I think, when you sign that piece of paper in your lawyer's office, it basically says, like, if I'm definitely going to live, then let me live. And if I'm definitely going to die, then let me die. But it doesn't give you a ton of information in between, just as far as like who you are as a person and what's important to you. And so I think those things, like having clarity for yourself and talking to your family and just having somebody there who knows you really well, who can speak for you, like that's the thing that I think is really important.
Now, as a physician, you talk with a lot of different patients and probably different personality types. In your experience, do you think most patients or people in general are equipped to sort of bring up those conversations when they're facing something, like terminal disease? Obviously, you guys were physicians. You had talked about this previously when your patients. How do you think that understanding is in the general population?
Yeah, I mean, I think most people are probably technically equipped, like potentially can do it. I think I'll recommend some books, actually. I think there is a whole cultural milieu, right? The battle metaphor is so prevalent, battle metaphor. It's so hard to talk about cancer without using the words battle or fight or, after Paul died, there was a local newspaper that published a story and it said, Stanford neurosurgeon succumbs to lung cancer. And it was like, he didn't succumb to lung cancer. He died, but he didn't succumb to lung cancer. And I think that's just like, that language is too simplistic, and so I think there are a lot of taboos like in our society about talking about this stuff, and it's just scary and anxiety provoking, of course. And I think at this particular moment in history, like dying and even just suffering are so hidden, like things are, they're just kind of hidden in a way that they haven't been in all of human history, I think. And so I do think it's incumbent on patients and families, and certainly doctors or nurses, to be talking about, like what's possible and what's not possible, even when that's really hard. And the books that I really like that help put some language around this and help people clarify like how to navigate the healthcare system. I really like Being Mortal by Atul Gawande, obviously. And then I like a book called, I think it's called Coping with Cancer. I think it's by Vicki Jackson, who's at Massachusetts General Hospital. And it's super great and insightful. And I also like a book called Life After the Diagnosis by Steve Pantelat. So those are some that are kind of practical for helping families think about this.
Did you read those while you were going through this, or is that something you kind of came upon after?
Mortal. And then the other two I just kind of like knew about as a doctor. And,
sure.
Yeah. Life After the Diagnosis actually came out after Paul died. But it's written actually by someone I really admired when I was a resident.
Oh, good. Okay. Well, maybe we'll add that to our book club discussion.
He's so nice, Steve Pantelat. He's gonna do a talk at TED Med this year. So if you don't have him, he's about to have a TED Talk come out, and I think it's really good.
Okay, good. I'll tune in for that. You also talk about, well, let's talk a little bit about grief. What has helped you in the years since Paul's passing? Through everything.
Yeah, so I was pretty crazy for about a year after Paul died. I was functioning and taking care of Katie and going to work and working on the epilogue for Paul's book, but I had a lot of physical symptoms of grief. That's one thing that surprised me. I had like really severe tingling in my hands that I thought was, I couldn't believe it was a grief-related thing, but in retrospect, and I got all this like medical testing because I was so scared about what it meant, and it turned out that it just like went away about a year after Paul died, and I think that was a physical symptom. And Paul in the book talks about how his mom actually had seizures after her own dad died. So I think, like, just to put it out there, I think the physical symptoms of grief are like really real, and grief is really surprising, and I think it doesn't feel necessarily just like sadness. I think people, can you hear me okay? My screen is frozen, but you can hear me?
Yeah, I can hear you and see you, actually.
Thank you. So I think grief can feel like anxiety or guilt or anger or whatever, I found it really helpful to read and talk about it. There's a book called Modern Loss, and a website called Modern Loss by Rebecca Sofer and Gabby Berkner, and has like all these essays and by people going through grief in tons of different ways. So I have found Modern Loss to be a really nice resource. And then I'm in a Facebook group that's called Hot Young Widows Club, formed by Nora McInerney, and that is also amazing, and it's like super honest and funny. So for anybody who lost a partner young, Hot Young Widows Club is really good. There's now men in it, so I like it. And it talks about everything from grief to dating again to just it's great. And people's partners have died from everything from cancer to suicide to overdose to other illnesses or accidents. So it's just like really illuminating. Those are some of the main things. And I think I felt very, very lonely for about a year after Paul died. And I thought I would never not feel lonely. And then life has totally filled in since then in ways that I wouldn't have expected. And so I think some of it is just about hanging on,
I'm sorry, what was that?
Hanging on.
Hanging on?
Yeah. Hanging on, yeah.
And time passing and just
time, yeah, but I also think like, I'm in so much less pain than I was before, but I certainly don't love Paul any less. And so it's been really interesting to me. I wrote an essay in the New York Times about this. It's called My Marriage Didn't End When I Became a Widow. And it's basically like that relationship, my relationship to Paul and the idea of Paul, and certainly with my relationship to Paul's writing and what's happened with his book since he died. It's like been interesting to just see how your feelings about somebody, or don't go away after they died. And that's been really comforting.
Is there anything else that you wanted to add that you think would be important to the discussion, something I didn't ask that you think is important to share with patients or survivors or even caregivers?
Not necessarily. I think I wish I could ask people for any resources about raising a kid who's developing a relationship with somebody who's not alive anymore. I think people have been through that with like grandparents or sometimes parents. I'm always looking for advice or books about that or whatever. I made Katie a book about Paul so she can read it and learn about him. She actually said something really interesting the other day that I'll just share. I have a little bell in our house that was among some party favors from our wedding. And these little things from India that were party favors at our wedding, and she was ringing the bell, and I said, that was a part of my wedding to Daddy. And she said, "Oh, was I at that wedding?" So I was like, "No, you weren't even born yet." And she said, "Oh, I was dead." And I was like, "Oh, that's so interesting." Katie's own conception of like non-existence, like she was dead and now she's alive and later people are dead again. And it's like just so interesting to have a child who's like a little bit exposed to these ideas. And like, we go and visit the place where Paul is buried pretty frequently, and she has no idea like what a grave really is, but she's sort of growing up into that idea. So thinking about like how to raise a resilient kid is different from thinking about how to raise like a happy kid and protect her from pain, So or completely insulate her from pain. So I don't know. I wish we could do a whole session. Maybe at some point you'll do a book club on supporting kids through this, and so be a viewer at that.
Yeah, we've actually recently just published a few things online about deal, but not after the fact. Basically, about dealing with the discussion with a terminal diagnosis.
That's so good. That's so.
One of the patient advocates, Adam Hayden, has brain cancer, and he actually has a background very similar to Paul. He's very philosophical, and he talks about talking to his kids about it. So,
that's so nice.
We can definitely, always use suggestions and
it's great.
Build our content.
There's at least somebody on Twitter who sounds kind of similar. So look him up.
What's that? I'm sorry.
I said I think I might have seen him on Twitter.
He's very big on Twitter. So yeah, and he kind of I read his stuff and it sort of reminded me a little bit of Paul's style because of his very philosophical. So yeah. Okay. Well, we're a little over time, but I want to thank you for spending time with us this afternoon. It's been wonderful getting to know you. I did want to announce too that we'll be talking about the book through the end of September, and on September 24th, we're going to actually have a new book, which is Extreme Measures: Finding a Better Path to the End of Life, and that's by Jessica Nuddick-Zitter. And I also want to thank you, Lucy, for taking the time from your schedule to spend time with us today.
It's my pleasure. Thank you so much, Marcy.
Thank you. Bye-bye.